And welcome here to My Country Y107 and our Baptist Health Ask the Doc segment. And Dr. Mike Carson joins us here today. And we live in a society where anxiety and stress are right at the forefront of everything we got going on, whether it's because we're stressed at work, with things at home, just societal pressures and so forth. How does stress and anxiety affect our health? And what are some things that we can do to maybe remedy some of that to help improve our health?
Yeah, stress and anxiety is probably one of the most common things that I see in clinic. Stress over time definitely does take a toll on your body in terms of gaining weight, in terms of causing other problems like heart disease and things like that. The studies have shown that there is a correlation between stress and a lot of different other health problems. The main thing that I try to do when I see a patient for the first time is really get an understanding of what type of anxiety we're dealing with. There is social anxiety, there are other kinds of anxiety, phobias, things like that. And really, in terms of treatment, it's really not usually just one single medicine or therapy. It's usually a combination of things that I find is most effective. Getting someone involved in counseling is very effective to help with anxiety. But then the medicines, there are some very unique and different medicines that we can use to help with anxiety. And for example, a lot of times I see patients come in that are UCA students or high school students and they struggle with test-taking anxiety. And that's something that we can easily fix with certain medications. A lot of the older blood pressure medications, being atenolol, propranolol, are excellent in those situations. And what they do is they block the body's response to anxiety. A lot of times people will come in and say, I start taking a test or I do a speech and I get pounding of my heart races, I start sweating, I get short of breath. And we talk about that is a panic attack. And there's some really good medicines that we use for that people can take before they take a test, before they give a speech, or before that they go to maybe some sort of a social setting that would make them very uncomfortable. Again, those medicines are good because they don't affect your brain as much. They really just block the response of your body to that fearful situation.
Well, Doctor, how can we get in touch with you guys, and how is Baptist Medical helping to deal with the area of stress in our lives?
Sure. So my clinic is over where the new Baptist Hospital is, right next door. We're actually building a brand new building that'll be done in July. And you can call us. Our number is 501-358-6702, and we can always get you in real soon.
Baptist Health, making a difference in an amazing community of Conway, and welcome to Conway.